he will elaborate the help of artificial intelligence in detection and score system. Yeah?
Thank you, sir. So, AnginaX AI is an intelligent healthcare system that fits on top of every single doctor's office. So it's like um, um, it's powered by artificial intelligence. As you know, currently medical establishments are using Framingham Heart Study, common traditional biomarkers for cardiovascular assessment, which is hypertension, diabetes, smoker, tobacco, all those things. Those are not enough biomarkers. Science has advanced, so we have incorporated scientific research in this system. So it's not just an AI, it's a convergence of biomedical research, clinical science, precise medicine, and also artificial intelligence technology working together to precisely detect patient's insight before patient comes into the doctor's office. So how it works, when patient's data is entered in the system, doctor will have insight of that patient's silent risk, metabolic dysfunctions, other lifestyle patterns as well, not just the typical cardiovascular traditional markers, but all of those, and provides detailed assessment, providing patient's clear trajectory path where he's headed. And so if you think about a patient is normal today and tomorrow he collapses, this 24 hours, what if we stretch to 24 years? And doctor can see that, visualize that, if this patient is heading towards up or down, and puts the halt on the progression of those cardiovascular disease and treats that, whether treatment is for lifestyle patterns or treatment is for medication or even other kind of treatment or further investigation. All those things happens way before symptoms arrive. That's how we're going to prevent life. So it's not really predicting heart attack, it's preventing heart disease way before symptoms arise. What are the currently we don't have limitation in the model because it's not for people, it's for doctors. So it's giving doctors some recommendation. Doctor can accept it or override it because doctors are the final judgment. They're not take judgment call at last. So the limitation is not there because it's giving more insights to doctors. Doctors now have more power to assess that risk way earlier, and they can have they can save more lives basically.
What's this?
This model is, as I mentioned, there are clinical biomarkers. We have incorporated number of biomarkers in that system, and these biomarkers are, for example, I'll just give one example. Most of the time, your regular doctors are looking at cholesterol level, LDL, and when someone has an LDL, they provide you statin. Now, the science, last 10 years science says, the LDL has two kinds of LDL. One is large buoyant, and second is small dense. Large buoyant LDL is cardiovascularly neutral. The small dense LDL is basically going under the surface of endothelial cell for the plaque formation, which is more dangerous. When you're prescribing a medicine to lower down your cholesterol level, your LDL level, you don't know whether it's large buoyant reduced or small dense reduced. AnginaX is going to help providing detailed assessment of your small dense, which is your more atherogenic for your plaque formation, for your cardiovascular risk assessment. Triglyceride to HDL ratio. So there are many different biomarkers. Currently, system is what if you go to doctor will see your assessment of 1, 2, 3, 4, 5 risk factors, and because of these factors, you have these symptoms, and will treat your symptoms. How AnginaX or any kind of AI works is combination of different biomarkers putting together in number of different patterns and providing you very personalized treatment plan for the individual patient's body and helping doctor that way before, so doctor can have an early assessment. So it's very complicated. I can talk to you separately about the AnginaX, but it's definitely helping detect silent risk way before, and doctor can can see those patients way earlier.
Thank you.
Look, I will say one thing. Our KPI for building this model, and obviously all the companies are going to do a lot of QA tests and test on different hospitals. We have tried a pilot and it worked fine. We have tried in Gujarat, in Zydus, we have tried, we're trying here in Maharashtra as well. But our KPI was whether it works for my mother. If it works for my mother, then it works for everybody. My mother was diabetic before putting her reports in AnginaX. The doctor of my mother is very senior endocrinologist, and he said everything is fine. As soon as my mother's report were put in the AnginaX, there were a lot of changes. We found out my mother was on severely high risk without any symptoms. And those doctors who were treating my mother now changed the medication and prescriptions, and now my mother is taking those. My mother is not aware of it, but doctors are aware of it. So I would say there is no more of bigger test than testing on my mother.
And
Look, people work whole life and then save money, and at 50 or 40 or 60, they go and they have a heart attack and they do bypass surgery and all those things. All the money is wasted, life is wasted, family is wasted as well, right? When we build this system, we want to make sure that the reason we are starting with Jaslok has always put patient first approach. They're always on, they're compassionate, they're affordable, accessible, compassionate healthcare, and so working with Jaslok is also, it's people first approach, and AnginaX is the same mission, which is, our forte is people. And the cost of AnginaX that we have kept is 108 rupees.
it's very nominal.
And the reason we kept it 108 rupees is because so people do not have to dial 108 for an ambulance call.
I would say, to give you an example, during Vietnam War, lots of young soldiers died. It's a rule that anyone who has an unnatural death has to undergo autopsy. And when the autopsies were performed on those young people between the age of 22 and 30, we found that they had already a beginning of atherosclerotic disease, meaning thereby deposits of fats and cholesterol in the inner linings of the blood vessels. So therefore, I would say that the process of prevention should at least start from early 20s. Time in the game, we've been now finding out, maybe due to better detection, maybe due to better awareness, maybe due to media helping to spread those disastrous news to make people aware. I think we are finding that younger and younger people are becoming victims of sudden cardiac death. So therefore, we feel that at least after the age of 25, there should be a checkup program.
Hello, I have a few questions. So are you using both of them or either or?
Alright, over a period of time, we'll be able to collect lots of data. There is a paucity of data in the literature on the Indian population. And it is not good to extrapolate the findings of Western countries and apply them to our country, which is wrong. And therefore, when we will have those kinds of data, hundreds and thousands of patients, it will help us fine-tune our own parameters and then use them for the treatment. We will come to know what is normal in Indian population, what is abnormal in Indian population. You know very well, India is the world's capital of diabetes. Highest diabetes in the world is in India. Now, so therefore, this will enable us to give an accurate advice and not to overtreat, not to undertreat. Ajit, you want to add anything?
I'll add in the sense that the question you had asked. There are two aspects to treating a patient is concerned. One is the primary prevention, and the second is what is called as the secondary prevention. When you talk about secondary prevention, the person already is afflicted with the problem or the disease, and then we try to prevent any further problems occurring. Here we are talking about a primary prevention. That means the patient does not have any symptoms related to any disease. As far as we are talking about cardiology, so we are talking about cardiac problem. He doesn't have any symptoms related to cardiac problem. What we want to do by this thing, by the parameters, which includes not only a physical examination, weight, as I said, history and this thing, as far as the biochemical data, we want to collect and see as far as the established Framingham study data and the other data which are telling you that this patient comes into a category. Now many a times what happens when a patient comes in, we look at only one or two aspects of the abnormal parameter. We miss on to the other things. Now what AnginaX is doing is that it compiles you and tells you what are the things you look for. So in a minute it tells us what are the things you have to stress upon and what are the actions you need to take upon. That is the advantage of the AI additional as far as the management is concerned.
So my question to you is like you said is 108. That is I didn't get the actual figure of the cost. The person who comes and does this takes these facilities from you, is it mandatory that he should be treated from your side only?
No, so patient can go anywhere where AnginaX is deployed, and we are working.
But there is only one, you said it's rightly in India by your side. Jaslok has this facility.
Yeah, right now, this program is for Jaslok. Jaslok is, we are partnering with Jaslok for that program. Jaslok is kind enough to, accept that affordable for patient as well. Prevention is not everywhere. You will see health checkup in most of the hospitals and clinics as well. That's fine, but those are very typical biomarkers, not detailed, extended lipid profiles or advanced markers, inflammatory markers, lifestyle changes, metabolic dysfunctions, genetic predispositions. Family history. There are many markers that we should put together. Jaslok, is leading that in front in Maharashtra. So we are going to talk about Jaslok right now here. But eventually, yes, our goal is to have AnginaX primary prevention model and unit in every single state, every corner of India. And that's our goal. We're working with government as well.
But with
to more specifically answer your question, having had gone through the detailed parameters of an individual and having identified and make him aware that this is your risk and it is absolutely free to take treatment from anywhere. We have no objection to that at all. Basically our idea is to extend to him those information which are useful for protecting his own life. I mean, after all, a man may be staying far away from Jaslok Hospital, maybe interiors of Maharashtra or even from up countries and whatnot.
that's a question.
It is not possible for him to have a continued follow-up treatment at Jaslok itself. So therefore, we are open. In fact, we will be very happy to extend all kinds of help to his doctor.
The question again said you that the people who comes from interior Maharashtra, he takes your facility. So how many days for him to should be admitted, or he can just
It will be totally outpatient, and the full investigations will be completed, including biochemical investigations, history taking, stress test, whatever we have a built-in package, and that tells all about his heart condition, which we all want to know, and that can be completed in less than 4 to 6 hours.
So now again coming to all the doctors. So most of the doctors are on toss when you are coming with the AI facility at that cost. So the cardiologists, the other doctors and all, even the what they are into doing all these things. So you are coming with the one point where everything is, you are showing that what prevention to be taken for them. What do you have to say for that? Now doctors are sitting here only, that there are other doctors also.
Yes.
So even now you have given this facility in Jaslok, and with everything, they don't have to wait for the symptoms to be appeared or wait for the, what you said is every hour some figures you gave that they die. So they won't be there, that kind of figures you mean to say.
So if I understand your question right, the facility is being provided right now from Jaslok Hospital.
Yeah.
Now it depends upon AnginaX as to where they want to collaborate with the other hospitals and with the government of Maharashtra or not. We don't
Okay,
know.
though they will be going ahead with that facility with other
Yeah,
hospitals.
Right now we are partnering with
Yeah.
them as the first partner for taking care of this particular program,
Okay.
which we thought is a good one, which will help us to detect patients who are at a high risk. And also, as Mr. Naman has already said, that this is in vogue right now in the state of Gujarat, where almost about 4 hospitals have incorporated it. And even the government of Gujarat is very keen to adopt it. So the whole idea is to take care of these people who do not present with any symptoms as far as cardiovascular problem is concerned.
If I have also understood your question, is this basically it is concerning the health of the citizens of India.
Yes.
Therefore, we would be encouraging the spread of such kind of programs all over the country, everywhere. This is the, I might say that I have become incidentally a catalyzer, stimulant, beginner, and whatnot. The idea is that it should be taken up even at governmental level, private level, and efforts combined together should be such that this benefits reach to each and every individual or citizen of India.
Naman, this initiative, what kind of doctors you are looking at?
Look, before saying that, I'll say one thing. When any patient goes to doctor, all of us, I'm not doctor, but all of us, when we potential patient or patient go doctor, we have this blind trust on doctor. The doctor are God. They're magically gonna fix anything for our family, and we go and fold our hands and say, doctor, please fix it. Doctors are working night and day, 24 hours on any type of call, saving lives. They are our hero. They're underappreciated. Now it's time that we make our doctors from hero to superhero, so they can save millions of lives. That's the first thing. So AnginaX is built to empower doctors, medical community, to provide them more insight so they can do 10x more accurate job, 10x more efficient job, and 10x more trusted job. And that's our main goal, right? The second thing is, your specific question was about AnginaX.
Yeah, like other way, how
Yeah.
you'll be with other doctors.
Because this is a cardiology assistant, specifically it's an AI doctor's assistant specialized in cardiology. It can be used by any doctor. Our first, when we were in the concept phase, we decided that we will build this system that can be used by PHC center, big hospital, privileged hospital, or even a GP as well. So this is going to be used by any doctor because it is, the fort is people. It is for the people. So first, yeah, it can be used by any doctors.
So in future, if the hospital will be have that angina, what do you call that facility available?
Yes, AnginaX.
AnginaX will be deployed across the country in every single street, every single corner of any clinics, and that's how the smart system is built. Patients right now are currently the model is fear-based model, right? Everyone is fearful to go to doctor. They don't want to go to doctor. We want to change that. You need to go to doctor so you don't have to worry about symptoms and disease. And that's the model that we're building here. It's a fearless model. You go walk in 5 minutes, you see your heart risk assessment, doctor will tell you what to do next. If you're fine, if you think you're healthy, don't come after 1 year, you have your report, you can go to check your other doctor as well. But at least you know your health. You have rights to know your heart health. Everyone is working so hard days and nights. The modern lifestyle is changed. We can't depend on 1948 Framingham study, which is way old. The things are, it's different now. So we have to really focus on new markers, new science, and the team has worked really hard to provide this kind of people first approach, and that's why it's
Have the
good work.
facility started in Jaslok?
The date is going to be announced by, I will let Jaslok announce it. There is an announcement date as well, but it's going to start in a week or two.
Okay. The facilities.
Yeah, we'll be starting by 4th of August.
Okay.
I have another question. It's a very simple question.
This is an OPD basis visit, and most of the insurances have now started covering it. Not all are covering it, but some of them are covering, TPAs are covering it. So it depends upon what kind of insurance the person has.
Thank you.